Does a thyroid scan use a contrast agent? Have you ever wondered if a thyroid scan uses a contrast agent? This is a common question, especially for those preparing for this important diagnostic procedure. A standard thyroid scan typically does not use a contrast agent like iodine-containing dyes. Instead, it involves administering a small amount of a radioactive tracer. Common tracers include radioactive iodine or technetium pertechnetate. The thyroid gland absorbs these tracers, allowing images to be produced that reflected its function and structure. Thyroid scans are a type of nuclear medicine test. They evaluate how well the thyroid is functioning by tracking the uptake of these radioactive tracers. The tracers emit radiation, which is detected by a special camera to create detailed images of the thyroid. This helps healthcare providers assess various thyroid conditions, including hyperthyroidism, hypothyroidism, and thyroid nodules. It is important to note that contrast agents containing iodine, such as those used in computed tomography scans or other imaging studies, are different from the radioactive tracers used in thyroid scans. Iodinated contrast media are injected intravenously to enhance the visibility of blood vessels and organs in imaging studies like CORT scans. While these iodinated contrast agents are not part of thyroid scans, their use can affect thyroid function tests. They can interfere with subsequent radioactive iodine treatments. For instance, excess iodine from contrast media can temporarily saturate the thyroid and reduce the uptake of radioactive iodine used for therapy or diagnostic scans. This often requires a waiting period of about 1 month before radioactive iodine treatment can be effective. Additionally, because iodinated contrast agents contain a significant amount of iodine, they can influence thyroid hormone levels. This is particularly relevant for patients with pre-existing thyroid disorders. Monitoring thyroid function may be recommended after exposure to iodinated contrast, especially for vulnerable populations such as young children or those with thyroid disease. In summary, a thyroid scan itself does not use a contrast agent. It uses radioactive tracers specific to thyroid imaging. However, iodinated contrast agents are used in other imaging modalities like CORT scans and can impact thyroid function and subsequent thyroid-related procedures. Understanding this distinction is crucial for accurate diagnosis and management of thyroid disorders. Always consult with your healthcare provider for personalized medical advice regarding thyroid scans and any related procedures.